When I see problems with people who come in and they get their braces off or have a lot of issues with white spots on their teeth, you may have seen that. We'll throw up a picture of some of the stuff that we've seen here in the practice or around. A lot of times what we see is acids, not sugars, acids will dissolve the teeth. They'll make white spots, and you have this perfect little spot where the bracket was bonded on the tooth, and then a big wide outline where you have the start of a cavity. When a cavity starts, it's white and chalky. Eventually it gets to be a hole and brown, and then you get all these other problems. But at first it's just a white chalky spot. So when we take those braces off, nice spot where the bracket was glued on and protecting the tooth, and then around it just a mess where we didn't have good brushing. Now, a lot of people think, like I said, that sugar is the cause of all these cavities. It kind of is, but really what happens is the bacteria in your mouth kind of eat that sugar, and then they excrete acid. So it's all about acid. When we have a lower pH, which is more acidic, that causes the tooth to actually dissolve. So when you get acidic stuff in your mouth, it takes about 15 minutes for your saliva to buffer everything back to neutral, where you aren't having these problems with your teeth and the teeth dissolving. And actually, minerals from your saliva will kind of go back in the tooth and repair it. So as long as you don't have more dissolving than you do repair, your tooth is going to be fine. But when you keep getting more dissolving, then you're going to start to develop a cavity. So as dentists, we say, avoid the sweet things and things like that. But then we have the perfect bomb, and that is a Coke. It has a lot of sugar in it, but it also has a lot of acid, phosphoric acid, same kind of acid I use here to dissolve the surface of your tooth just a little bit to be able to glue a bracket to it to roughen it up. Then we have a super bomb like the atomic bomb, Mountain Dew. It has citric acid, which is even stronger. So, I tell people about this stuff. I see it all the time. If I see a lot of decay or white spots or something like that, man, it's Mountain Dew a lot of the time. Even the diet Mountain Dews and Diet Cokes have a lot of acid. They don't have the sugar, but they have this really strong acid content. So I thought, how can other people see what I'm seeing every day? So we decided to do a little experiment here where we actually got some teeth and we suspended those teeth in Coke, Diet Coke, Mountain Dew, Diet Mountain Dew, and then one for water, just to kind of show you something that's neutral and the difference between the three. We did it for 2 weeks. We changed this stuff out daily. We freshened the Coke up. I haven't looked at what's going on under there. I've got a spot so we could suspend the tooth where we bonded a wire to that tooth, which is the same glue we use for braces. So we'll get to see what happens to a protected area of the tooth where we bonded that glue. I'll cut that off in the video here so you can see it. Interesting little note, we'll be using a regular kind of dental drill, which we call a handpiece. That thing turns at about 400,000 RPMs. So we'll take a look at that as we go and see what happens. I'll find out at the same time you do, but I have a pretty good idea. Okay, so this is our setup. We have just a regular jar. We drilled a hole in the lid, and I bent a wire right here. And then we used a tooth-colored filling material, same stuff we used to bond brackets, and I glued this wire to the tooth. This tooth is solid white because we bleached it to sterilize it in peroxide for 2 weeks. And wax this wire in so that when we put it in here, and this has been set, we can just screw this on and it's suspended completely in the solution. And this has been in water for 2 weeks after being soaked in peroxide for 2 weeks. So we say no large change, and we'll go ahead and take this off. All right, so this is Diet Mountain Dew, 2 weeks. To be honest, I expected to see a little bit more damage on the tooth. Obviously, it's stained it, especially the root. But this has, again, artificial sweeteners, but lots of citric acid, which is fairly strong. So let's take this bonding pad off and we'll see what we got. We can see right here, it's really starting to dissolve the root. I don't know if you can see the ledge right here between the enamel and the root. If we compare to the one with water, we see just a smooth transition. And we can see it's probably taken out 5 to 10% of the surface diameter of this root here. And that's just a big drop off. Obviously 2 weeks in just a Diet Mountain Dew has caused a lot of damage. So again, no chalkiness on the surface, but we do see where the root is being dissolved. Some of this material is just kind of flaking up and disintegrating. We can see this material that's just dissolving away here. So you can see how nice the tooth surface is here, and then this is what's been exposed to Diet Coke. 2 weeks, just 2 weeks. You know, I'll be honest, I expected Mountain Dew to be much worse, but looking at this with the Coke, we can see how much this enamel just dissolved. You can see this large drop off right here. See the nice enamel surface? The one in water.